Pop quiz. When are you most likely to make a deadly mistake with medication? During a crazy emergency? When you're super busy with 6 patients? Wrong. It's when you're so tired that your brain can't even read numbers correctly. Want to know why? And what you can do to protect yourself and your patients? Look, I get it. Most nursing students and new nurses think medication safety means being careful and following the rights of medication administration. But here's what they don't teach you in nursing school. There's a special group of medications where just being careful isn't enough. These are called high alert medications. And if you're a new nurse or a nursing student, you need to understand this. 80% of serious medication errors, the kind that end careers and lives, happen with these drugs. You see, the consequences of an error with these particular drugs are clearly more devastating to clients. The scary part? Most new nurses use them every single shift without even knowing which ones they are. Have you heard of the double check method? I'm going to tell you something about this that just might shock you. But first, let me make you a promise. In the next few minutes, I'm going to give you something that most nurses don't learn until they've had their first close call or worse. You'll learn the Joint Commission's top 5 high alert drugs that you must know, the science behind why your brain stops working when you're tired, and some things you can do to save your patient's life and your nursing license. By the end, you'll have a complete safety system you can use right now. So let's dive in. This is the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hurst Review's got your back. Listen close, stay on track.
Hey guys, I'm Ashley. Everybody calls me AG. Let me paint you a picture of what really happens on the floor during a long shift. You're several hours into your shift. Your patient needs their sliding scale insulin. You're exhausted, but you've done this 100 times in clinical. You pull up the order, blood glucose 234, give 8 units regular insulin subcutaneously. Simple, right? But here's what's happening in your brain that you can't feel. Research from the Journal of Patient Safety shows that when you're tired, your ability to recognize decimal points gets worse by 340%. Your occipital lobe, the part of your brain that reads what you see, literally starts seeing 1.0 and 10.0 as the same number. So you draw up what you think is 8 units, but you've actually drawn up 80 units. And here's the scary question. How would you even know? Let me break this down with real data from the Institute for Safe Medication Practices. High alert medications aren't just dangerous drugs. They're like loaded guns in healthcare. One mistake with the wrong dose, wrong concentration, or wrong rate causes devastating harm or death. Did you catch what I said? It will cause harm. No maybes here. The Joint Commission identified the top 5 medications that every nurse must know. I want you to count these on your fingers as I say them. 1. Insulin, both subcutaneous and IV. All forms, regular, NPH, long-acting, rapid-acting, and especially insulin U500. 2. Opiates and narcotics. IV, transdermal, oral. Morphine, fentanyl, hydromorphone, all of them. 3. Injectable potassium chloride or phosphate concentrate. This one has killed patients so many times that most hospitals don't even keep concentrated potassium on the floors anymore. 4. Intravenous anticoagulants, especially heparin. 1 decimal point mistake with a heparin drip, and your patient bleeds out internally. 5. Sodium chloride solutions above 0.9% concentration. Yes, even saline can be high alert when it's concentrated. Let me tell you about something that happened in the past that still haunts the nursing community. An experienced nurse was to administer IV furosemide, but accidentally administered IV potassium instead. That particular shift, the nurse was tired and gave the wrong medication. The patient's heart stopped. They tried to resuscitate. They couldn't bring her back. 3 months later, the nurse quit nursing. They couldn't walk into a hospital anymore without having panic attacks because of the homicide investigation. One exhausted moment. One medication error. That's why what I'm about to teach you next isn't optional. How can we be more careful? The double check method is one way. However, the way most nurses perform this is pointless. What do I mean? Picture this. You've drawn up 10 units of heparin. You walk up to your coworker, Sarah, who's charting at the nurse's station, and say, "Hey, can you verify this is 10 units of heparin?" She looks at the syringe, nods, and says, "Yep, that looks good." That's not a real double check. That's confirmation bias in action. Here's what the Institute for Safe Medication Practices defines as an independent double check. And this is super important. The second nurse performs a complete verification from scratch without being told what you think the dose is. Let me break down what that really means. Step 1. The second nurse goes to the chart and reads the original order themselves. Not what you tell them, the actual order. Step 2, they calculate the dose independently. If the order says 0.5 milligrams per kilogram and the patient weighs 70 kilograms, they do the math themselves. Step 3, they verify the medication name, concentration, and form. They're not just looking at your syringe. They're checking the vial or ampule you drew from. Step 4, they confirm the route and rate. IV push versus IV infusion. Over 2 minutes versus over 30 minutes. These details kill patients. Studies from Johns Hopkins show that proper independent double checks catch 95% of high alert medication errors before they reach the patient. But the quick glance method, the one most nurses use, catches less than 12%. Why such a huge difference? In the independent method, the second nurse's brain has to do all the thinking work, not just agree with you. And that thinking work is what catches errors. Here's a real case. A nurse prepared an IV push of digoxin. They asked a coworker to verify 0.5 milligrams of digoxin. The coworker looked and confirmed. The nurse administered it. The patient coded and died. During the investigation, they discovered the order was for 0.05 milligrams, not 0.5 milligrams. A decimal point error. But because the second nurse was told what to look for, their brain never did the calculation. So now you know why the double check, if done incorrectly, fails. Here's the framework that really works in the real world, even when you're fighting exhaustion. This is what separates safe nurses from nurses who make headlines. I'm going to give you 3 layers of protection. Think of them like a safety net with 3 levels. If one fails, the next one catches you. Layer 1, know them. I'm going to give you a mnemonic to help you remember these medications. Are you ready? Incredible owls prefer apple slices. Incredible owls prefer apple slices. I want to take this a step further though, because at Hurst Review, we like explaining the why, because knowing the why helps you know and understand the material and not just memorize. So let's talk about why these medications are in the top 5 list. Insulin. Why is it high alert? Because too much causes severe hypoglycemia, seizures, coma, death. Too little in a diabetic crisis can lead to DKA or HHS. Opiates. Why are they high alert? Respiratory depression. Your patient can literally stop breathing. Potassium. Injectable. Why injectable specifically? Because IV potassium given too quickly or in too high a concentration can cause fatal cardiac arrhythmias. Your patient's heart can just stop. Anticoagulants like heparin. Why so dangerous? Too much causes hemorrhage, bleeding into the brain, GI tract, anywhere. Too little and your patient develops a clot, stroke, PE, MI. Sodium chloride, greater than 0.9%. Now, why solutions above 0.9%? Because they can cause severe hypernatremia, leading to neurological damage, seizures, and cellular dehydration. Standard protocols exist for a reason. Use your facility's color-coded labels and automated alerts. Most hospitals put bright red or orange stickers on high alert medications. If you see that sticker, your brain should automatically trigger independent double check required. Don't override the smart pumps without understanding why. And here's something that might help you. At Hurst Review, we have downloadable resource documents like high alert medications and tons of other critical nursing topics. These quick reference guides are made specifically to help nursing students pass the NCLEX and succeed in clinical practice. They're great tools to keep with you during your shifts. Layer 2, independent double check. Here's the hard truth. Finding a second nurse when you're exhausted and the unit is understaffed feels awkward. It feels like you're bothering someone. It feels like you're saying you don't know what you're doing. But here's what's more awkward. Explaining to a patient's family why their loved one died because you were too uncomfortable to ask for help. So, I'm going to give you the exact script to use. Memorize this. I need an independent double check. Can you verify this order from scratch without me telling you what I think it is? Layer 3, cognitive forcing functions. This is based on human factors engineering research from NASA and aviation safety. When your brain is impaired by fatigue, you need external structures to force correct thinking. When you're tired, use these decimal point awareness strategies. Strategy 1, always write a leading zero. Write 0.5, never 0.5. That tiny zero has saved countless lives because it makes the decimal point impossible to miss. Strategy 2, never use trailing zeros. Write 5, not 5.0. The Joint Commission banned trailing zeros for this exact reason. They cause tenfold overdoses. Strategy 3, physically point to each digit while reading aloud. Your finger forces your eyes to slow down, and speaking activates different neural pathways for processing numbers. Strategy 4, use the teach-back method. Explain to yourself out loud what you're about to give and why, as if you're teaching a student. I am giving 8 units of regular insulin subcutaneously because the patient's blood glucose is 234, which falls in the sliding scale range of 200 to 250. Some shifts, you'll use these strategies and catch nothing. Other shifts, you'll catch an error that would have killed someone. You never know which shift it will be, which is why you do it every single time. And here's the part that will change how you practice forever. Remember that question at the very beginning? When are you most likely to make a fatal error? You know it's not about being careless. It's not about being a bad nurse. It's about understanding how your brain works under fatigue and having systems in place to protect yourself and your patients. The danger of nurse fatigue is real, but it doesn't have to be dangerous when you use independent double checks, recognize all high alert medications, and employ cognitive forcing functions during fatigue. What can you do to practice safely? Here's what I want you to do before your next clinical or shift, and this is important. Action step 1. Print out the Joint Commission's top 5 high alert medications and tape it inside your badge holder. Every time you open your badge, you'll see them. Action step 2. Before your next shift, walk around your unit and identify which high alert meds are on your floor and where they're stored. Action step 3. The next time you need to administer insulin, heparin, or potassium, even if it feels awkward, even if you've done it 1,000 times, find another nurse and say these exact words. I need an independent double check. Can you verify this order from scratch without me telling you what I think it is? That one sentence could save a life. Maybe today, maybe next week. Your patients trust you with their lives. Your nursing license represents years of hard work, sleepless nights and studying, and dreams of making a difference. And somewhere, right now, there's a patient who will be on your unit during your next shift. The framework you learned today, knowing the high alert medications, doing true independent double checks, and using cognitive forcing functions, is the difference between a career you're proud of and a mistake you can never take back. Your responsibility as a nurse isn't just to follow the rights of medication administration. It's to recognize which medications carry heightened risk, understand why they're dangerous and what can go wrong, implement every available safeguard without cutting corners, speak up when you see unsafe practices with these medications. You're not just a nursing student or a new nurse anymore. You're a nurse who understands high alert medication safety at a level most experienced nurses never reach. You've got this. Stay safe out there, think like a nurse, and act with intention. So until next time, future nurses, current nurses, and retired nurses, thanks for tuning in to the Nursing Navigator.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.